Hello and welcome. You know that feeling, right, when you're in a medical situation, maybe in another country, and you get that little knot in your stomach? Not because of the problem itself, but because you just can't find the right English words? Well, if that sounds familiar, you are in exactly the right place. Today, we're going to walk through a typical medical story, step by step, to give you the key words you need to feel confident and in control. So let's dive in. I want to start with a question for you. Just think about it for a second. What on earth could possibly be worse than that throbbing, nagging pain of a toothache? You guessed it. It's having that pain and not having the words to tell anyone about it. That feeling of being totally misunderstood, especially when you're feeling vulnerable? Yeah, that's what we're here to fix today. Okay, so let's set the scene. Imagine this. It all starts with a sharp pain in one of your back teeth, and it really hurts when you try to chew something. It's a classic story, and unfortunately, a really common one. And here it is, the first most important word you absolutely need: toothache. It seems so simple, doesn't it? But just being able to say, "I have a toothache," is the key that unlocks everything. It tells the doctor or dentist exactly what's wrong and where the problem is, all in one go. So, you know the word for your problem. You have a toothache. What's next? Well, you've got to get it looked at. It's time to visit the dentist. A dental visit usually follows these three pretty simple steps. First up, you call the office to make an appointment. Then, when you get there, the dentist will give you a checkup. That's just their way of saying a basic examination. And finally, you'll discuss the treatment, which is just the plan for how to fix that toothache. After your checkup, the dentist is probably going to suggest one of two very common treatments. If it's a small problem, like a little hole, you'll likely need a filling. But if the tooth is really damaged and can't be saved, they might have to do an extraction, which means taking the whole tooth out. Knowing the difference between those two is, pretty important. Okay, let's just pause here for a second. Quick question for you. Are you afraid of dentists? It's a super common fear, no shame in it. It's a really great question to just practice answering for yourself in English. All right, let's make our story a little more interesting. What happens if the problem is more complicated than a simple toothache? Sometimes your regular doctor might say, "You know what? You need to see someone who's an expert in this." And that expert? They're called a specialist. Think of them as a master of one specific area of medicine. They've spent years and years studying just the heart or just the skin, or in our story, maybe the kind of complex procedure you might need. The process with a specialist is kind of similar, but usually a lot more detailed. After you meet them, you'll probably have to undergo tests, things like an X-ray or a scan, so they can get a really clear picture of what's going on. Then, based on all those results, the specialist gives you a diagnosis. That's just the official medical name for your problem. Okay, this brings us to a major turning point in our little medical story. After you get that diagnosis, you might have to make a really big decision about having an operation. The word for this is operation. You might also hear it called surgery. It's a major procedure where a surgeon actually has to cut into your body to fix something or take something out. It's a serious word, so it's really, really important to know what it means. Now, before you ever agree to an operation, your doctor will sit down and talk with you about the benefits versus the risks. The benefits are all the good things, how it's going to help you get better. The risks are the potential bad things that could happen. It's so important that you understand both sides before you make your choice. So, who's on your team here? Well, first, and most importantly, there's you, the patient. Then there's the surgeon. That's the specialist who actually does the operation. And you'll probably have another specialist who's guiding your whole treatment plan. See, it's a team, and you're the star player. To help make these words really stick, let's use them for something else. How about this? What are the benefits and risks of regular exercise? Try to think of a few for each side. It's a great way to practice these words in a totally normal, non-scary conversation. Okay, so the operation is over, and it was a success. But the journey's not quite done. Now we get to the final and honestly the most hopeful part, recovery.
Your recovery will probably start in a hospital ward. That's a room you might share with other patients. While you're there, the nurses will look after you. What a wonderful phrase, right? It just means they'll take care of you. Soon, you'll be well enough to go home, and then the final goal is to fully recover.
Here's one more practice question to make that phrase feel totally natural. Think back. Who looked after you when you were a child? See? Using these phrases in different ways is how you really start to own them. We've just walked through an entire medical journey together, from that first little pain to a full recovery, and you've picked up a ton of essential vocabulary along the way. But, and this is a big but, just listening to me isn't going to be enough. So here's the most crucial point of all. You can read lists of vocabulary all day long, but your speaking will not get better until you actually use the words. You have to open your mouth and practice saying them. We've given you the tools, we've given you the map for this journey, but now the most important step of all. That one is up to you. So I'm going to leave you with a challenge. It doesn't have to be some big dramatic story. It could be as simple as the last time you had a checkup. Using the words we've learned today, what's one medical story that you can now tell in English? Think about it, and more importantly, try to say it out loud. You've got this.